Hi, I'm Martha Peterson. Welcome to Essential Somatics. I'd like to show you an IT band release that does not involve the use of foam rollers, deep tissue massage, cross fiber friction, or any other things like that. The IT band pain is indicative of a larger pattern of contraction in the center of the body. And 100% of the time what I see is that people with IT band pain and tight IT bands are actually stuck in a pattern of trauma, what we call the trauma reflex pattern in Hana Somatic education, which is a brainstem reflex in response to accidents, injuries, a sudden loss of balance, an injury on one side, so there's a need to compensate on the other side. And what happens in a trauma reflex is that there is a little bit of side bending, twisting, and rotating in response to these injuries or accidents or compensation patterns. And that causes the pelvis to shift, the legs to take an asymmetrical amount of weight, the gait to become a little bit altered so that perhaps you're walking like a car with one flat tire. And the IT band on one side of the body tightens a little bit more to create a sense of stability. So once we address the trauma reflex in the center of the body, relax and release the waist muscles on both sides, the IT band releases. So I just want to show you what I usually see with somebody who comes into to me with a tight IT band problem. They're often shifted to one side of their body, like this. And this is a very typical trauma reflex. I can actually, as I imitate this posture, I can feel my IT band beginning to tighten and my thigh beginning to tighten. The weight, as you can see, is shifted to the right. There's a little bit of a pull down here with my shoulder. My hip is tight and hiked up a little bit, and I can definitely feel tight waist muscles over here on the right side. There's more length and openness on my left side. And as you see, my shoulders are out of balance. That is a very typical trauma reflex. This is more balanced posture, weight on both feet, shoulders level, and my IT band released and my thigh feels nice and relaxed. So I'm going to show you a release for the IT band that not only releases the band, but also the muscles in the center of the body. When you address the pattern that is at the root of the pain, you'll find that your pain goes away, it stays away, and you have more efficient movement from the center of the body out to the periphery. Cushion your head with the arm against the floor and extend your top leg. Let's say that this is my tight IT band side. Extend it to the bottom of your mat. Flex your foot and lift your leg straight up to the ceiling, contracting the side of the leg, okay? You can put your top hand up against your thigh and push up into your hand just to make sure that you're really contracting that IT band as you flex your foot. Once you feel that contraction, very slowly lower your leg, very slowly. You might feel some shaking or jerking. And when it comes back to the mat, completely relax it. Do that one more time just so that you can feel that contraction, what it feels like to contract it and to release it. So extend your leg, flex your foot, lift it, 3 or 4 inches. Feel the side of your leg with your hand. Make sure that you're contracting it. You might feel a contraction in your buttocks as well. And very slowly lower it to the mat and completely relax. Now let's add the hip. Extend the leg, flex the foot, lift it a couple of inches. Now draw the hip up towards your armpit so that the side of the leg is tight, the hip is drawn up, squeezing the oblique muscles. And now slowly Release through the waist, bringing your hip back to neutral, and at the same time lowering that leg, and then completely releasing it. Let's add the last part. Wrap your top arm around your head, extend the top leg, flex the foot, contract it up a couple of inches so that you can feel that IT band tightening, and on the exhale, lift your head, pulling your ribs down and your hip up. This is a variation of the side bend. And very slowly inhale, releasing the oblique muscles, lifting the ribs up out of your waist. The hip comes down, at the same time the leg lowers and completely relaxes. What we're doing is we're going into the pattern of contraction and then lengthening and releasing out. This is a pandiculation. So let's do it again. You're going to lift that top leg, flex the foot, contract the side of the leg. Exhale, lift the head, draw the hip up to meet the ribs, making an accordion with your waist muscles. And now lengthening and releasing out of it. The ribs come up, the hip comes down, the leg slowly lowers and completely relaxes. I would also suggest combining this IT band release with the side bend, the wash rag, and the walking exercises from my Pain Relief Through Movement DVD. Bringing in movements that address the back muscles, the waist muscles, and the abdominal muscles will go a long way toward teaching your brain, retraining your brain, to retrain your muscles to move with balance and symmetry. And this will result in a reversal of any IT band pain and the ability to keep it from ever coming back. Thanks for joining me.